Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I'm going to go through how I treat ice pick scars tonight. I'll go through this particular case. This is a Hispanic patient with some hyperpigmentation as well as ice pick scars. So we have to be pretty careful with her skin. You'll see we got pretty close to scarless over here. You can see very, very difficult to see the majority of those scars. So some of them are just like completely gone. Even if you angle the lighting as much as you want to, it's still very, very difficult to see those scars. So really, really nice because it's a process that's been tried and true over the years, especially with these techniques where we just localize the acid of something called TCA directly at the base of the scars. And then I did do a little bit of laser to smooth down the edges of the scar as well. And in this case, we didn't want to go too aggressively or with too much heat or too much energy over here. So really nice. You can see, look at that improvement over the course of a little more than about a year and a half, you could say. So we started April 2023, and here December 24, you could see, just look at that really nice improvement there. I'll make this a little bit bigger so you can see it, and let's see if you could kind of appreciate just how close to scarless it got with this. This is with we captured this one with the Vectra camera, which can show ice pick scar as well. So it's nice to have that for standardized lighting, and then we can see those little ice pick scars. This is with TCA Cross. Most patients for ice pick scars need several sessions. The first session, though, we did do a laser to help soften up the edges. And when she came in again, I was going to do another session. I did another session of TCA Cross and laser here. So usually with the depth of these scars, it could take 3 to 4 sessions sometimes of TCA. Not necessarily so much of laser, but a lot more with TCA. It's kind of interesting because a lot of people would just say just to do laser over and over and over again. But I mean, you're not going to be able to do that really effectively in somebody who's a Fitzpatrick 5 patient. She also has evidence of a little bit of melasma as well. She has post-inflammatory hyperpigmentation. So, it's someone we have to be very, very careful with. And I was asked yesterday to put some patients up who had more mild results, and here's somebody with what would be a little bit more mild here. And so you could take a look and see what to kind of expect if you have scars of this depth. And people say, well, can you get rid of some of the scars? Yes, some of those I would say are gone now. Maybe not 100%, but like it is very, very difficult to see those scars now. Really difficult. So I think for all intents and purposes, it's close to that. Do I recommend subcision? Well, it depends. Sometimes if there's a bundle of ice pick scars, and yes, we could do subcision to break up that scar tissue, but it's not necessary for a lot of patients actually for ice pick scars. It just sort of depends on how thick the scar tissue is and what we're seeing with it tethered down over there. This is a darker skin tone. This is a patient who also has hyperpigmentation, melasma. So this was, people are asking what's the best treatment. So this was with TCA Cross as well as an erbium laser for her. And then through the laser channel holes, I put a dilute form of Sculptra to stimulate more collagen here. So you can see that, again, really, really nice. Safe result. Most of our patients are darker skin types, so we have to go really patiently, really slowly with this. We don't want to overheat the skin. And then on top of it, she has hyperpigmentation. What would I recommend for one ice pick scar on the tip of the nose? A lot of times it's just going to be a serial TCA crosses, like just multiple times. It could take a while though. Sometimes it's slow. Also, for those joining us on certain platforms like TikTok, actually you can make it widescreen right now. So just you can see a widescreen, and that way you can see it a little bit better, by the way. Appreciate you, Monarch. Thank you so much. So if you're just joining us, I changed the format a little bit, at least for the next couple of weeks. I'm going to try this out. So you could go widescreen. You can see it a little bit bigger now. Although supposedly the app is going to be banned soon, so I don't know. But maybe not. We'll see. Hopefully not. Let's see here. Where were we at? How much are the treatments for ice pick scars? So most patients for scars are they spend about $5,000 to $7,000 total for most of this. If they had a lot more volume loss, then it could take a little bit more. But there's a way to do this. There's a way to do this even in darker skin types. And my patient earlier today in the morning, she's actually a Fitzpatrick 6 patient, and already just after a couple sessions of TCA Cross, we could see enough improvement over here, actually to really nicely lift up those scars which are deep in Fitzpatrick 6. But I was just doing TCA Cross as well as like just lower energy lasers there. How can we avoid getting them in the first place? Well, you have to treat cystic acne pretty urgently. If you have cystic acne, we do want to make sure we can control that really well. And that's either with antibiotics or potentially with oral medications such as oral antibiotics, or you may need to be on something like Accutane, or what we use also is the cure laser. So all those could be options there to prevent it. Of course, picking at it is not going to help either, so that's another thing to pay attention to. But a lot of my patients do not pick. They will just remember that there was a story of really just, especially one of my patients earlier today, he had a big indentation in the side of his cheek, and he just knew when it happened, so it's like you hear that story over and over and over again. A saying, no matter what face wash I use, my face always breaks out. Help a little bit for some scars like this, because it will help reduce the oil production. It'll help with the diameter of the scars a little bit, but I wouldn't say things for volume is really, really critically important for us, because we want to make sure that after we do these scar treatments, you don't still have the indentation from the fat loss that occurred. Hi, Tichin, how's it going? Good seeing you on, by the way. Let's see, some people were saying there's a bit of a lag. I don't know if there's a lag still, but if there is, let me know. I tried to make everything faster actually lately. That's why I changed this format a little bit. I thought maybe it'll make it a little bit faster. Oh, hey, Explicit Virgo, by the way. How's it going? Good seeing you on. Let's see here. Where were we at, though? I missed a few questions here. Oh, sorry. We're tretinoin fix this. Oh, so yes, yeah, my stream was lagging for you. Sorry. So tretinoin would help with reducing the diameter of these scars. It'll do that. It'll reduce the diameter a bit, but it's not going to actually really fully solve these scars, but it may make it a little bit less visible for you. So it's definitely not a bad idea to be on tretinoin, especially for these kind of scars. In general, it's just tretinoin is good. So, consider being on tretinoin. I've been on it for a long time. I'm a huge fan of tretinoin. So, you definitely are not going to hear me say don't be on tretinoin, because the more people are on tretinoin, I think it's better in general for us. Because you really will see improvement over time with that, because it's like your oil production goes down, and then also you do get more of a collagen response. Your skin's just going to feel and look a lot better. Obviously, be really good about sunblock, be really good with that when you're on tretinoin, but it's really, really useful. Start low dose, like 0.025, mix it with a little bit of moisturizer for the first week. You have less chance of purging that way. You also could use a little bit of Claritin for that first week to help prevent that purge also. So just a few little tidbits there, hopefully that'll help you. Can you do TCA every month? Yes, you could. As long as you're healing okay, you could do it. Yes, that's true. Best creams, oil, serum for spots on the face. Are you talking about like red spots, dark spots? What kind of questions? Thick Fits is saying, what is the treatment? Or microneedling? No, this is with TCA Cross, and in this case, I used an erbium laser. So TCA Cross with erbium laser. This is somebody, to be honest with you, almost really until I kind of started talking about this before, a lot of patients of the skin type were turned away. They said that they would have been told, you can't do anything for these scars. There's nothing you could do. They're told just to live with scars, just you have to accept it. And we hear about it all the time. We see patients all the time who are told that they couldn't do that, and that's why they were sold like these microneedling packages, and they're told to do 6-12 sessions of microneedling. The guy I showed you yesterday, he did 10 sessions of microneedling. And it's like really unfortunate. If we look at this, we got amazing, incredible results. This patient had tried microneedling actually before. We got incredible results with TCA and with a low energy laser like an erbium laser with this, and that's all we need to do. And then there's other people that would say the only way to treat acne scars, in fact, I can remember to this day, these guys were telling me this, they're like, the only way to treat acne scars is use high heat. And there was a guy actually, he would like close his eyes, he would like act, it was as if he was like, I shouldn't say act, but like he was almost, being extra dramatic about it. He's like, the only way to treat acne scars is to do multiple passives, high heat, high energy. And that's what he would say to do. He's like, with CO2, you go down to the depth. And it's like, it's not. It's just not true. And, all he was doing was Fitzpatrick's 1 and 2s. So I guess with that, maybe that would be okay. But it's still actually not the best, because if a Fitzpatrick 1 patient had ice pick scars like that, you're still not going to be able to get enough improvement with it. So really, TCA Cross is going to be one of the best options there. Just wanted to say thank you for your time. I see you next month, and you answered so many questions. Appreciate you. Look forward to seeing you next month. Damar is saying, could filler give a temporary 80 to 100% improvement on rolling scars? I don't know what the percentages mean. I don't know, but yes, it will make it much less visible with a temporary lift with filler. That's why I usually use more collagen-producing products, because I always want to have something to support that scar tissue and to improve that scar tissue over time. But the percentages, so many people, now a lot less people ask me about it, but so many people would say that they were promised, actually people have come to me and said that they were promised that they were going to get 80% improvement with RF microneedling. They were told by a dermatologist, that they had scars like this and they would get 80% improvement. I don't know where they got those numbers from. I don't know how that came in their mind, but that's what they promised. And there's ways of doing it, but you have to go really slowly in darker skin types especially. You don't want to overheat the skin. And, it's variable because everybody's collagen response is different. You're based on your age, your ethnicity, your smoking history, the oil production on your skin. We really want to control oil. You can see oil is better controlled here. Oil, if you look at most of our results, the oil is better with the treatment. So there's a reason why. I want to make sure that we can get less oil, and that way we can get a really robust collagen response. So it's on purpose. I want that way. So if you look at these patients, there's less oil afterwards. Initially, for the first week, you get a little bit of oil, but afterwards, it's like you want to get that under control. And we really want to make sure that you have less chance of inflammation with the oil production and less acne. Sailor Moon's asking, what lasers are best for anti-aging? Well, actually, a lot of them, almost all of them are really great for it. The Pico laser is awesome for anti-aging. Almost everybody who does the Pico laser ends up feeling that their skin is tighter. They do feel like there's a bit more of a collagen response with it. I have a patient that I was doing on her one side of her face for a birthmark removal with the Pico laser. And a few months later, she was saying, I really got to do it on the other side because the side that I was doing the birthmark is firmer, it's more lifted. It looked like there was almost a little bit more volume on that side of the face because of the laser. So that's a great option. And it's really what's awesome is that it's safe in all skin types too. And then we also could do an erbium laser or a low-level CO2 laser for anti-aging purposes. When I think of anti-aging, really, I'm thinking more for younger patients. I'm thinking more patients who want things preventative. I'm thinking patients, are trying to avoid, skin laxity. They may be trying to avoid fillers or, a high dose of Botox in the future. And so that's what I'm thinking maybe with the anti-aging. So with that in mind, usually I'm trying to do things that are going to maximize collagen response, but still have less downtime because really the younger patients usually don't have to go as aggressive for anti-aging purposes. So the Pico laser could work really well. Erbium laser could work well, but it just sort of depends on what the skin type is and how much downtime they have. Sailor Moon's asking, how is erbium different than CO2? How should we choose? Well, I'll help you choose, but basically what I do for someone like this, a patient who's Fitzpatrick 5 or 6, typically I will use more of an erbium laser because that's going to have less heat, less energy, whereas the CO2, it could help with stimulating more collagen production and remodeling the skin a bit more, but there's more risk involved. Usually the risk is really more with hyperpigmentation, but it's also possible to actually lose pigmentation with the CO2 laser. Usually it's more of a transitory type of thing. It's not like it's a permanent problem, but it could potentially happen. So we got to be very careful that if it's really worth going down that route. There's some people who would try to argue that even in Fitzpatrick 5 and 6s, that they only do fully ablative CO2 laser for acne scars. They just do not believe that minimally invasive or fractionated CO2 lasers or fractionated erbium lasers are enough, they're going to improve it. Those same people, though, don't do TCA Cross, and a lot of times they don't do things which are going to stimulate more collagen production or give more volume. So, that's probably why they're so laser focused, and they try to make sure that they push it, or I should say they push it as heavily as they do. I'm not as laser focused as a lot of people in this industry, actually. I like it. I definitely use it every single day, multiple times a day, but it's like a tool that I use. It's not like the only tool. Like in this case, we had to do TCA Cross over here, and that was really effective. And I went directly at the scars, and I got it so that we pretty close to scarless with that, and yes, we did use a laser, but this is somebody that it would be reckless to do fully ablative CO2 laser on her. The scars are not that bad. It's not that deep. I don't understand why you would. There was a patient recently that had similar scars like this, and she was told, and she has similar skin type, and she was told to do a phenol peel. And it's and again, it's reckless and wild. I don't understand what that came from, because that the dermatologist is recommending to do a phenol peel on that. It's like on ice pick scars. And actually, the phenol may help a little bit with some of those scars for some of the ones, but there's some of these are relatively deep, and it's like it's not going to be enough. And you just put a potentially high risk treatment on a patient that didn't need to. And we got that same result without, in fact, I think better result without putting the patient at risk like that. Are we accepting new patients? Yes, we are. Yeah, you go through our page at drqazi.com and we'll be happy to help you out with you. Dr. Huang is saying, what concentration of TCA should be used and how often should it be repeated? Well, the concentration varies depending on the depth of the scars. So if it could really widely vary, anywhere from 35 to close to 100% sometimes. It just depends on how deep that scar tissue is. And the frequency, a lot of times it depends on the skin type and how the skin is responding afterwards. There was a study that was done that they were saying to do it every 14 days or so, but I don't really know if that's necessary that like really. I mean, that was just what one person found that improved their outcomes. But frequently is okay. You're just not going to see much of a difference between that time. So let's say you do the TCA Cross and you do it again after a few weeks, you're not going to see really any change really at that point, which is okay. You'll get it eventually later on, but just pay attention to that. So don't expect that the patient is going to be looking at you and telling you that it's better already, because it's going to be slow. This is more than a year later. So just to give you an idea, I think that expectations have to be really a lot more realistic for these. Amy's saying, currently in PA school studying for my derm module. Awesome, Amy. Good luck with all that. And actually, a lot of we have PA students actually all the time with us, and they're doing their tests, I think this week or next week, I believe. So good luck to everybody who's coming up with those tests right now. What are your thoughts on a mini facelift for acne scars? I think it may stretch out and improve some of the scars, but a lot of patients actually that I have who've done facelifts or lower facelifts, and they were sort of disappointed in the fact that their scars were still really visible, even when they combine it with a CO2 laser at that time. Part of it's because you have to undermine the scar a little bit different than what they do with a facelift. And part of it's also because you have to do other things such as a TCA Cross for these ice pick scars, or you may have to do some things for filler or volume. So like potentially fat transfer when you do that. Michelle is saying, do you think antihistamine like Zyzol helps with Accutane purging, or can it get in the way of it? Yes, I do think so. Yes, I'm a big fan of that. You could do Claritin, Zyzol, or Zyrtec. Zyrtec, for some patients, makes them drowsy, so I usually just say Claritin. That's the easiest thing for people, really easy to get. Would tretinoin give these results? Will soften up a little bit. It'll help reduce the diameter a bit, but it's not going to give these kind of results though. Let's see here. Is Shawnee saying, my doc said I have shallow ice pick scars and TCA Cross won't be ideal. Which treatment should I go for? Well, I haven't seen you, so I can't say for sure, but it's good that they told you that they couldn't do it, because clearly, maybe they're not comfortable with it, but you could do it even for shallow scars. I mean, a patient I did, two of the patients I did today had that. They are essentially taught sometimes, and I've actually talked to a lot of people who seem to think that you're supposed to use just 80% on each individual scar, or 90% or 100% even on each individual scar, and wherever they're trained, and it's just wrong. It's just flat out wrong. It's not true at all. And, it doesn't matter where you went to school and like you were told that, it's just wrong. So it's just, that's what it comes down to. It's just not true. Like to do 80% to 100% could be catastrophic. I actually treat a lot of patients with TCA burns, a lot actually. Some of them do it at home. Some of them have done it with dermatologists in the area who, not just with the skin type, but also they've been concerned with, with the way they do it. Some people have said that they use fans while they're doing the TCA, and the TCA actually splash all over the face. Really, really unfortunate. They also used really high concentration for shallower scars. I understand that there's a lot of people who probably shouldn't be doing TCA Cross, honestly. So much is saying, you say you've used Bellafoot for the past 6 years. However, are you not worried about the skin effects after 10 or 20 years when your skin starts to sag in age? There's a gentleman, he got trained over at Stanford. He's a Stanford facial plastic surgeon, and he's been doing Bellafoot ever since it really came out when it was like Artful, and really runs into no problems with it whatsoever. And he's an older patient, physician. I guess I shouldn't really say his age per se, but definitely 60s, So it's like, to him, he had no problems with it, and he had it in his face back when it was originally came out under a different brand name, and which I believe is like 15, 20 years ago. So really no problems. It really is about how you inject it. And I've seen the way he injects, and typically what I've seen is like, it's like tiny little micro droplets. He's not shoving a bunch of filler in one spot. And that's really the key with this. It's about putting tiny little droplets around. But again, Solmacha though, I actually don't try to push people towards Bellafoot. I like it. My face is full of it. I've been doing it. It's a good product. But if you think that you want something else, sure, I just want you to do something for your volume to be able to improve things. So it's not like I'm sitting here. I'm not paid by Bellafoot at all. I'm not by any company. And you could just, I'll say it over and over. I'm not. And so I have, and even in fact, actually, I'll just tell you, they came by the other day and wanted me to do some things, to talk about it more, things like that. But I'm saying it's not related to that at all. It's just because I like it. And I said to them, I was like, I'm going to stay always independent. And I always just want the regular pricing, all the stuff that's the same. I want to be treated the same because I actually always want to be independent from any sponsorship. That's really important to me. I like the product, and when I say I like the product, it's because I like it. And I want everybody to feel that way. It's not like it was pushed on me. It's not like I have something with it, like some shears in Bellafoot or anything like that. It's like I could use other products. It doesn't matter to me. I like it. It just works really well for scars. It supports the scar tissue. It worked really well for my face. It's it gives good structure, gives some nice support for it. So it's of course I'll tell people that it's great. That's why I push it, because it's it works really, really well for me. And I think that just like people said, don't do TCA Cross. So many people said, do not do TCA Cross. Or they told me, use high energy lasers. Use high energy lasers for scars. And they're just wrong. It's just the bottom line is a lot of people are wrong. They're wrong about the way they injected. You can look at now today, look at the consequences all around you. Go walk around Fashion Island, go walk around Beverly Hills. And a lot of these people went to people who they said, are in the top of this company and all this stuff for Allergan and everything like that. And it's you see the results, you see the consequences just while you're walking around the town. And does it really look like these guys really did really know what they were doing with some of the stuff? And they were pushing it, and they were telling people, and they were doing these trainings and things. And when they were doing these trainings, sometimes you go up there. First of all, they were sponsored by the companies. And then second of all, they would be explaining things that were just inaccurate and later on caused catastrophes. They were telling everybody to use a cannula. Everybody was just cannula. And they're telling people to do a cannula relatively superficial for certain products. It really caused a real problem. I dissolved a patient right now. She needed 6 vials of Hyonix to dissolve so much Volbella and Voluma in her face. Another guy that had Voluma in his face too earlier today. And it's there's so much, these chunks of filler that was confirmed in ultrasound. And it's like, they go to top places with this stuff. So I think we kind of have to look at things and say, well, just because this person was pushing it, the way that they're pushing it, maybe they don't necessarily know it for scars, or maybe they don't necessarily, maybe we shouldn't really necessarily trust them for other things, because just because you use hyaluronic acid doesn't make you an expert in collagen production, doesn't make you an expert in Bellafill or Radiesse or Sculptra. They're very, very different products. And so it just the way you inject it is very, very different. And it's like you have to be really a lot more respectful of the product whenever you're injecting it. So I would kind of put aside like the things that people say, and like I see sometimes that people say that they had problems with filler or things like that, but there's a way to do it, and I agree that the way that a lot of people were doing it was not the best. It potentially did cause problems. So that's my thing. I would say just like a lot of people, before I even came on to this thing, so many people were saying all over and over, do not do TCA Cross. And now nobody says that anymore. Everybody recognizes that TCA Cross works. Everybody knows now. And they used to say, do not do it in darker skin types. We showcased that you could do it in darker skin types. And they were saying you could only work if you do 80 to 100%. Not true. So interesting. It's the aggressive treatments that they were trying to push were just not true. It wasn't true. Miriam, I was waiting for you to come on. You asked for a more mild case, and so here it was. I was showcasing that. So this was TCA Cross and erbium laser, and then some more TCA Cross. So you were asking, other people were asking too for some things were a little bit more mild than normal, the more severe cases we do. Let me show you something over here. I'm going to zoom in a little bit so you can see and appreciate these scars a little bit more, because I do want you to see actually some things here. You can see this here. Oh, let's get this guy a little bit bigger for you. And now with this new widescreen format, you should be able to see it. Actually zoom in, you can see that really, really well. So take a look at that. Hopefully you can see it. Everybody sees that really well. So you can see, I don't know what percentage this is. I don't know. What is the percentage? I have no idea. No, this is with TCA Cross and fractionated erbium laser. I very, very rarely use fully ablative erbium laser. And the way we did this was with the TCA, with the fractionated erbium laser, and then afterwards we put through the laser tunnel holes a dilute form of Sculptra for this patient. So you can see really, really nicely, a great improvement there. And for those on the other format, you can take a look and see. Hopefully you can see that really well. Pretty cool, right? Look at that. That's really, really good. All right, where was I at there? I missed a few things here. So I saw a bunch of questions about tretinoin, so I'll repeat that. Tretinoin is good, but it's not going to solve like completely, these kind of scars. It will help with them. I'm definitely a big fan of tretinoin, but it's not going to solve it. It's not going to actually make them just go away. So it's like, here we have it. You can see that there's less oil production, so it'll reduce the width of the scar, but it's not going to actually just get rid of the scars completely. So that's what it'll help. Tony Santana is saying, can I use tretinoin as soon as I'm off of Accutane? Do I have to wait? Yes, you should do it as soon as you're off of Accutane. Oops. I know I lost my place here. So a bunch of questions here on multiple formats. So bear with me if I missed you. I'll be happy. I'm trying to keep track of all the different ones here. Michelle is saying, does Accutane help with acne, post-inflammatory erythema as well? I don't have any deep ones. Yes, it does actually. A lot of times it will help with that. I appreciate you, Miriam. Thank you. Tretinoin reduced the harshness of scars for Miriam, which is awesome. Yes, because it reduced a little bit of the oil production, which stimulated some collagen too. And then, yes, you will see a little bit of a softening effect of some of the scars, which is awesome. That's why it's always good to do it. Will microneedling help? It may help a little bit, but this patient, she did microneedling before. It didn't help. I don't find it really too helpful for these ice pick scars, to be honest with you. It's not going to help too much. Doctor, where can I reach you? You can actually go to my page at drqazi.com, and we could be able to, you can see the prices that we have over here as well. And then you can also basically just schedule a consultation that way. Consultations are going up next year, by the way. So you can, even though we're booked, just schedule a consultation now. It is going up next year. I'm letting just the live audience, you guys know about that. How many months apart is this result? So even on low dose with your treatments, Want to do it ASAP, but it's still on Accutane 10 milligrams? No, you do not have to wait 6 months if you're on 10 milligrams. Tony Santana is saying, can I use tretinoin as soon as I'm off? Yes, you could. Health Zen is saying, what about Morpheus? Can that help? So that's a really good question, actually. Let's talk about Morpheus 8 or other radiofrequency microneedling devices for ice pick scars. Is it going to help? And have they been able to show that Morpheus 8 or radiofrequency microneedling can help for ice pick scars? I think it's really worth asking that question. I haven't really found it to be effective for ice pick scars. Ice pick scars, we know there's a depth to the scars. We know that we really want to actually break down the scar and then also trigger a collagen response. So the problem with Morpheus 8 is that there's a little bit too much heat and too much energy for what you potentially may need for scars. And then that could potentially cause fat loss, and that could be a problem. The other thing is that it may not just be puncturing round into those ice pick scars and maybe missing some of those. I don't ever find it particularly helpful. It doesn't just do enough for these kind of scars. Liv is saying, got Morpheus treatment twice on ice pick scars, did nothing. Yeah, I really don't think it should be pushed for ice pick scars. The only time I think it may be valuable is if you have some laxity in the skin and you do subcision and you're doing it with subcision. Then it can make a little bit of sense. But the amount of heat and energy that's needed for Morpheus 8 for ice pick scars could make it a lot riskier option compared to what we did, which was TCA Cross, and then also with an erbium laser, which is not as hot. Ayana is saying, what do I use for stubborn scars on my chin that won't go away? Are you talking about like thick scars, or are you talking about like just like deep scars? I guess I have to see what you're referring to. Oh, and speaking of those thick scars, Damar is saying, do you treat papillary scarring on the nose? Absolutely, I do, yes. After you do it, basically use a ablative CO2 laser, and then usually you want to use a silicone tape afterwards, and sometimes a little bit of steroid injectable or through laser tunnel holes. Water break. Just a little bit more. I went a little bit over time, so I'm just going to get a little bit more water. Yeah, sure. For ice pick scars, TCA Cross, one of the best options. Also, if these were deeper, I would have done an excision. And then in this case, we also did a little bit of a mild erbium laser here. So Matcha saying, how much time do you wait before doing the next round of Bellifull? In other words, how much time do you wait for the 80% to dissolve? Well, it depends on how much volume loss there was. If you already knew that there's room to put a little bit more volume, then it's okay. But a lot of times I do wait about 3 months or so before that 80% to go down. So typically that's what I would do. Now, just because 80% went down doesn't mean, sorry, I still had a little bit stuck in my throat. 1 second here. Oh, whatever. Everyone's thirsty. All right, so just because the 80% goes down doesn't mean that you only are left with 20%. You still get collagen response over that remaining 20%, just so you know. So it's actually pretty nice because you still get some improvement with your skin and your scars over time just by putting some Bellifull in there. Pretty cool. Unusual product. There's not many products like that. It's the only FDA approved one for scars, the only one. And there's nothing else that's going to continuously make collagen around it. So pretty cool. I'm going to wrap up. I know I missed a bunch of questions here, but let's see where I was at here. What's my thoughts on exosomes? And I don't use them because they're not FDA approved, and they actually put a letter out there against it. So that was my take about it. I'm okay with trying things that are not FDA approved per se if it's like just off label a bit, but like they actually put a letter against exosomes. Will you need Bellifull forever? So you have 20% of it in your skin. You potentially just need to continuously put a little bit more there just to get to full correction. And then as you get older, you are going to lose a little bit of weight. Sometimes your collagen is going to change and fluctuate. So then, yes, to keep up with that, you do a little bit more Bellifull. But it's not because it just goes down completely. It's just you get older and you lose a little bit of weight, some fat, and you have to do something more there to support it. Ayana saying, doctor, I had a chemical burn from AHA, so it scarred like a burn on the chin. Well, that with a burn scar, first of all, sorry that happened, but burns really, really difficult for patients because it's like you're trying to do something to help your skin, such a chemical burns like that, and then you're left with a burn like that, really tough. But CO2 laser is one of the best options there, really, really is. How long would you recommend to start tretinoin 0.25 after Accutane? Pretty close to immediately, actually. So that's what I usually do. But mix it with a lot of moisturizer initially. Just get your skin used to it a little bit there, but pretty close to immediately. Why not use ablative laser on her to get an even better result? Okay, good question. So would it be a better result though if she had like more prolonged hyperpigmentation and then she also potentially would have had hypopigmentation? Would it have been worth it? No, not really. I mean, for me, it's not worth it because it's just, there's a lot more stress involved with that. It's just like anytime there's like any pigmentation, I get worried about it. I want to make sure I can clear it rapidly, and I always do. But like, I look at it like, man, I gotta get this clear for the patient because I'm sure it's really frustrating for them to have that pigmentation. So I take it very seriously. I jump at it really early on, which is why after we do the scar treatments, I always follow up to make sure the pigmentation is safe and it's headed in the right direction. So it's like really risky, and I'll be sitting there constantly stressed out or worried. You're going to be constantly stressed out or worried about the pigmentation. Although it'll ultimately get better, it's just going to, be like, another few months of pigmentation, and maybe that's too stressful for you. So it's like, I don't know, is it really necessarily worth it? And it doesn't necessarily give you better results. The pigmentation could be worse without better results. And I still got excellent results here. I mean, I'm not sure what you would really achieve with doing a fully ablative there. I really don't. How does he fix them? This is with TCA Cross and an erbium laser with us. That's what this was for. Let's see. I know I missed a question, but does that answer your questions that we're asking? I know Soul Macho was asking questions and Aya was asking questions, so I got back to there. Gino saying, I've seen some of the procedures you do in your profile. Is there a ceiling as to how many times you could do them, subcisions, lasers, or is it infinite and beyond that nothing happens anymore? Well, I think just in general for your skin, it's not a bad idea to do more lasers, like low energy lasers, things that stimulate collagen production, like anti-aging ones. For scar purposes, you don't need to do multiple subcision sessions. Almost always, it's just one single session. Every once in a while, you may have to do twice, but it's not multiple sessions. And if you just do it effectively, that's all you have to do. Lasers for scar purposes, there may be a limit though. Correct. Yeah, I may not want to keep on burning down the skin. We may say that there's just not going to be that much more improvement there. We've hit a ceiling here, and it's something I may have to say. There's probably not going to be much more improvement. I'm not sure. I feel comfortable and confident when I'm looking at something, and I recommend a treatment pathway. But there's maybe times I say, I'm not thinking this is going to be too beneficial for you. Like the person that was asking about doing fully ablative, it's like, I don't think that's really going to be worth it for you, because it's like, we could still get a great result without that. Or maybe it's just not going to change too much, so I would rather let's not do an aggressive treatment. A lot of times people ask me themselves, should I do subcision? And, maybe scars like this. And I'll say, no, it's probably doesn't seem like it really. I don't think I have to do it. And it's like, these are invasive procedures. So it's like, I'll tell you, a lot of patients, I tell them, you don't have to do subcision. It's just not necessary. If people say, do you need to do a pellicle? Do you need to do this? I'm not sure. I don't know. Let me break it up the scar tissue first and then see. I don't know. Right now, it's tough to say, because it's just relatively superficial, relatively mild. I think most of it's just stuck down. If we break it down, maybe that's all I needed. Maybe I just need to lift there. I am saying, can you do CO2 laser if you have dark skin? You could, yes, you could, yeah, but it just has to be justified. It has to be thick scar tissue. It's got to be there's got to be a real reason why. Don't just do it for all scars the way someone told me to do. That's the only thing. Why do I prefer an erbium laser? I like it because of less heat in darker skin types and patients with melasma here. Do I ever do phenol to do cross? Yes, I did it yesterday on the patient that I did the day before for a phenol peel. That may be around the only times I usually use that would do a phenol. I don't know why I would really, because TCA is just excellent. I can just change the concentration, and the pharmacy just sets it up for me really, really well. So it's I could just trust it. That's really the big reason. I like things where it's I focus on my stuff, and then other people that are professionals focus on their world. And so I don't want to, act like a pharmacist. Sure, do I understand a lot of the stuff? Of course, but like, it's better for me to focus more on like this side of things. So it's like, I just have the pharmacist mix up the TCA for me and just like do it at the exact concentration that needs to be. So I know exactly what I'm doing every time. And I know some people say, well, it's cheaper just to do it in your own office. It's like, I don't care about that. I just want it like where it's safe for patients. It's exactly what I want. And like, sure, I imagine that you're not messing up with the way you're mixing your TCA at your office, but you're not a pharmacist, dude. So I don't know why you would do that. Like, just have the pharmacist do that, and they'll do it. Like, that's their job. They do it really, really well. They do it more than you. It's like, sometimes I think I'm pretty good with blood draws, but like, before it was like, someone would say, I want the doctor to draw blood, but it's like, honestly, the phlebotomist draws like way, way, way more blood than me and is way better at it than me. And usually nurses are better than me. And so it's like, probably you just jumped all the way ahead to try to go with me. But like, actually, they're really, really good at drawing blood. So I'll probably stick with them for the blood draw. So that's kind of what I would say. The same type of thing is for doctors who mix their own medicines and things like that. It's like, I don't know, because you don't do enough of that potentially. And probably just let pharmacists mix exact concentration you need to for TCA Cross. Is microneedling or Morpheus beneficial? I got that one actually earlier. I would say not so much really for these scars. It really is not. And people on here were agreeing that they did it and it didn't really help them. Please talk about keloids. The thing with keloids is that a lot of times you don't want to use too much heat and too much energy. So it's very different than the hypertrophic scars you may see on here or the atrophic scars. And so instead, what we do is usually just more steroid injections and then maybe something like 5-FU. So things like that. You don't have to do actually too aggressive treatments with that. Thoughts on Genesis Resurfx for acne scars? Are you talking about laser Genesis or are you talking about Resurfx? Resurfx, I don't think is going to be too helpful for scars, to be honest with you. Maybe help a little bit for anti-aging, but not so much for scars. So I don't think that's going to be the best option for that. Can shallow atrophic scars be treated topically? Like somewhat, they could help. You saw Miriam on here earlier was saying that she did tretinoin and it helped a little bit, softening up a little bit of the edges of her scars. So awesome. So yeah, it's possible to soften a little bit, but definitely this patient was on it before. She also did microneedling before. Didn't change too much for her scars. I have scars since I was a baby. What should I do? Well, I have to take a look and see what kind of scars. Maria is saying, I did RF microneedling and erbium, hoping it will make a big difference. I'm still healing on day 7. I hope so too. Hope you do well. Eliza saying, do you use cannula method with Belafil for scars? Sometimes I do Belafil. Sometimes I do it with cannula. Sometimes I do it with needle. It just depends on the area, depends on the scar type. Sometimes there's a lot of different ways of doing Belafil, and I hope I can explain it one day. But you may see sometimes I do it with needle, and you may see there's ways of doing it with a cannula. So Mancha's asking, is there a reason you didn't specialize in dermatology as a physician? Well, I've talked about it a lot of times on here before. Well, first and easiest thing is that I said a while ago, which is just really true to my heart, because it's just still sometimes miss it. Is I like saving lives. I just didn't like the system of it. I hated the system that was the hospital system. The healthcare system is just terrible. And it's interesting that I think a lot of people have woken up to that, really. You could talk to almost anybody that ever worked with me as a nurse, the nurses that knew me in the ICU, around the floors, everywhere. Everybody knew that I did my job very, very well. And I was exceptionally careful with patients, and I saved a lot of lives as well. So it's it really mattered to me. But it really was terrible to me that I will, save some of my positions or those 9 a.m., 10 a.m. So it's that's the thing that they cared about. They cared about the fact that the physician was discharging on time. That's what they were happy with. And it was it was really unfortunate. It was really unfortunate to see that day in, I was doing 1 week on, 1 week off and things like that. And it was 1 week on, I'll be doing that and trying to save a life. And then every once in a while you hand it to the wrong doctor. It's the wrong person. It was the wrong person. And, it was it sucked. It sucked. It really did. It's like I sat there and I would code a person over and over and over again. There was a 23-year-old, like one of my first weeks of residency, that we coded for so long, like the entire shift and then some we did. And then it's like, she still died because you handed it off to another team and like they did take care of it. But like that was tough. It's like you do that over and over and over again. And then it's like, then you do it and you try to save someone's life, and then the family wants to pull the plug, or they do something that was like maybe not the right choice. It's that right moment, or something happens, and it's like was out of your control. And it's like, man, this is like, I want something that I am responsible from start to finish. And I really understand a lot of this world because I went through this. And I think so many people do. I think so many more people, it's not just scars. It's like pigmentation. There's things with, just volume loss, hair loss. There's a lot of different things that cause anxiety. There's so much more anxiety than people realize. There's so much more stress. There's so much more loneliness than people understand. And it's like, man, if I could like make an impact in that little world, in this scar world or volume loss world, restoration world, then that would be pretty impressive, because I think it affects a lot of people actually. And maybe people could just have an understanding there is hope out there, and you don't have to feel as lonely about it as you are, because it turns out everybody, you'd be surprised how many people come to me. You look at them, you may think they're beautiful, but they're like worried about certain things, and they're like insecure about certain things. And there's some people who will look at that and try to pick at that kind of person and try to put that person down because it may make them feel better. And there's other people, and I think that's the majority of people, that actually do legitimately want to help those people out because they sort of see themselves in it and see that like maybe, at one point I also kind of felt that way a little bit there. And sometimes I am a little bit insecure about a certain thing. And I could see where they're coming from. Even if it does look kind of mild to you, you sort of recognize that and think, maybe if I could help them feel better about it, maybe this will be better for people, and maybe the world will be a little bit better. Maybe there'll be a tiny little bit less loneliness out there, and then there'll be less violence out there, less anger out there. And it's like, that'll be pretty cool if you could do that. If you could have impact in that bit of the world, and it's like a real huge change in someone's life that ultimately they become a better person, and then they pass it on to another person. That's a pretty cool effect that you just had. And now, we've been treating, thousands and thousands of patients at this point. I think I gotta get the new numbers. Last year it was like 15,000. I'm not sure what the number of patients we treated now at this point, but it's a lot of people, and like a lot of like really like excellent results over and over and over again. So it's like, it's pretty cool. It's pretty cool to have that. And then maybe that made some people feel like they could do something good for someone else. And they now went through this. I have a lot of patients who are med students, a lot of patients who are residents and stuff. So it's pretty cool. It's pretty cool that like they now know that there's like hope that you could do something. There's a way to do something, and you could do it really properly and really effectively. That's a pretty cool feeling. And now some of these guys said that they're going to do this. That's what they told me. They said they're going to do this. They thought that there was nothing like this out there before, and they're like, they're going to do this. That's awesome. There's like dermatology residents, people that are aspiring to go into just medicine, things like that. And they're like, I want to do what you do. That's pretty cool, because it would be really nice if more people could do things safely. It'd be really nice. It would be really good for everybody if everything was just like done at a really high level. Like, it'd be awesome. Everybody would benefit. Can you get rid of festoons on the face? Those are really tricky, honestly. Festoons can be really tricky. Sometimes you do have to do a little bit of subcision. Belafol actually does help with that as well. So you could do that, and then you may want to do something for skin tightening. If you're like Fitzpatrick 1 to 3, then you could do a CO2 laser, and then you could also do, or you could do Morpheus 8 over there. So those are all options there. Have you treated papillary acne scars on the chin? Yes, definitely. I do that. I like probably literally once a day. Today it was twice a day, but I like all the time. And it's just actually really rewarding. Usually more common in men, at least I find. Juliana's saying, what's the difference between Radiesse and Belafol? Radiesse is a calcium-based product. It also does more for elastin production and skin tightening. And Belafol is actually made out of cow collagen as well as 20% PMMA. So it's both of those. And what it does essentially is that that Belafol will continuously stay in the system and hopefully help you generate enough collagen around it. So that PMMA. Question, if I book a TCA appointment with you, would that be okay, or do I need to do that along with other treatments? No, it's okay. It's just that you have to recognize that it's very, very slow. It's slower than you expect. And then sometimes for thicker edges of the scar, you do need to still do laser. And then if there's some volume loss, you still need to do something for volume as well. So, it's up to you what kind of results you're trying to shoot for. TCA, of course, we could improve things over time, but it's not going to be likely enough though for you. Let's see here. Han is saying, I saw a nurse injector push a client's acne scars out with a cannula during her PRP microneedling appointment. So you're saying she did subcision? I'm a little bit confused about pushing it out. Does Bellothil show instant results for indentations? And it does a little bit, but not so much, honestly. It's more of a thing where it's like over time, it gets better and better, but like initially it's not so much with a volume. AA saying, I have a deep ice pick scar. Plastic surgeon told me not to mess with it if it's too deep. Help. Well, I'm not sure why they would say that. You could actually take out the scar. When can we expect to see the new pheno result? 3 months, probably. So he's all wrapped up right now, so we won't be able to show that though, but in 3 months, he said you could do it. He should be okay with doing the scars, he said, so hopefully. I haven't had too many people with sharing results, but you can see right here, there's nothing, if you guys are kind enough to let me show it, you can see there's nothing that anyone else could look at this and say, this is that person, this is showcasing scar results. So if nothing else, if you could let me share that, it's really appreciated. Is that subcision using a cannula needle to push out acne scars? I'm not sure what that means. Like she's underneath the skin and she's literally, the cannula will pop out as well from that. I'm a little bit confused. How about trauma scars, getting stitches? Yeah, I definitely could help with trauma scars. It just depends on location and the depth of it. But, there's multiple different tools that we could do for it. Is that subcision? Yeah, so I'm not sure. She stuck it over. Han, I guess just send it over to me. I'm not sure what that, or tag me into it. Tag me in the video. Feel free to tag. I'm actually way behind all the tags you guys did. Sorry. I haven't had any time to do any real, I should say real. This is real to me, but any produced video content in so long. Actually, I just have no time. It's so fun to just do back-to-back patients, but then I can't really do the things of educational, explain things during the day as much. So that's why sometimes I am okay with going overboard a bit, because I actually like going through things. There's so much information out there. There's so many things that people wonder. So it's nice to do it. Let's see here. I'm way overboard for tonight, but let's see if there's anything else that I should hit though before I end. Hopefully answer everybody's questions though. If there's anything pressing, let me know. I have a minute or two that I was just gonna wrap up here. Can you address surgical scars in a penis? Serious question. I guess I'm concerned I'm confused of what kind of scars you're referring to for it. What happened? I did have a patient that had a circumcision at 7 or 8, and he had a bit of a scar there, a little bit of scar tissue around the circumcision area, because apparently he had to do it in an emergency situation. So that was unfortunate, but I'm not sure which area you're referring to. I know I missed a few other things, but if there's anything else that was pressing, kind of repeat that though for me. Okay, so this was TCA Cross, and this was an erbium laser in this case. So that's what I did for both of these. What would be the treatment for papillary acne scars? You could burn it down with a CO2 laser, and then you could also use a bit of steroid as well in there, and then you usually want to use silicone tape as well. Thoughts on Resurfax? I'm not going to help too much with that. All right, guys, I appreciate you. I'm going to go wrap everything up right here, and we'll see you tomorrow. Appreciate you, Han. Thank you so much. Appreciate you.